Hi, this is Jill Schiaparelli. Welcome to HealthTech Talk Live, being broadcast to you worldwide on iHeart Radio. We're here today on the expo floor of the UBM Canon Medical Design and Manufacturing Conference in beautiful Philadelphia, Pennsylvania. We're talking to innovators and people who contribute to tomorrow's medical device designs. And I have with me Dr. Michael Drues, President of Vascular Sciences in Boston. Welcome, Dr. Drues.
Thank you, Jill. It's a pleasure to be here.
I'm so glad you're with us. Tell me a little bit about what Vascular Sciences does.
So Vascular Sciences is my consulting company.
Okay.
I work with a variety of medical device companies, as well as I work as a consultant for the FDA, basically helping companies bring products, medical devices onto the market here in the United States and around the world.
Wow, you have such an impressive background in both academia and industry, and I noticed you were asked to speak on a panel at the conference this week.
That's correct.
The topic was biocompatibility versus bio-friendly, which should come first? And first of all, for our listeners, what is the difference between biocompatible and bio-friendly?
So biocompatible is the standard that we've been using in this industry for more than 50 years. It basically means we put a material into the patient's body and nothing really bad happens. And we've been tolerating that as a standard for a very long time. But one of the reasons why we wanted to have this debate was to see if we can raise that bar a little bit. Because instead of having materials just simply tolerate the body, after all, compatible doesn't mean that the body likes the material.
I see.
It simply tolerates it. Some of us have been working to try to create materials that are friendly to the body. In other words, the body actually likes those materials.
And okay, so biocompatible means tolerates, it's
Correct.
there, does no harm. Bio-friendly means the body likes it.
That's correct.
How do we know that a body likes it?
Well, that's a good question. One place to start is, are we born with it, or does the body produce it? Because most of the materials that we make medical devices out of today, these materials were never designed to go inside the human body. Many of these materials, in fact, come from the clothing industry, from the textile industry.
Interesting.
And we now are using them to make medical devices out of. And you don't have to have a background in medicine or engineering to appreciate that, gee, maybe that's not exactly the best approach.
Sure. And is bio-friendly becoming a more commonly used term, or is it just a small group of people?
Very slowly. It's still a very small but growing group. And there are a number of challenges, not just on the technical side, but also on the regulatory side. Because let's be honest, there's a lot of momentum in this industry. We've been doing things a certain way for a long time, and a lot of people want to continue to do them that way. I learned a long time ago that there's a reason why people refer to your comfort zone as your comfort zone.
Sure.
And it's very difficult to get some folks to get out of their comfort zone.
Okay, so give me an example of a material that's bio-friendly.
Well, again, so a lot of the materials that we're using, for example, in the biotechnology industry, proteins, for example.
Okay.
You know, you have lots of proteins in your body right now. Your body are used to seeing proteins. They're used to working with proteins. Similarly, nucleic acids and carbohydrates and lipids. These are all the polymers that you produce in your body naturally. Think about it this way. One of the things I mentioned in this discussion is, if we're not born with it, if your body doesn't produce it, should we put it into you? For example, and this is true on the metal side as well, many of our orthopedic implants are made of metals. Stainless steel, titanium, tantalum, nitinol. But the problem is, most people are not born with any of those materials inside of them.
Got it.
So the question is, if we're not born with it, should we be putting it into you?
And because you brought up metal, I'm wondering what the clinical applications are that are driving this. Is it orthopedics or is it cardiovascular?
It's across the board.
Else?
So
it is.
certainly
Okay.
orthopedic as well as cardio, but I would argue that every area in medicine, every ology that you can think of would benefit in one way or another from more bio-friendly materials.
It'll be really interesting to see how this debate plays out and to see the evolution over time. Let me change the subject. We're on the floor of the UBM Canon MedTech Conference. Floor's been buzzing, a lot of activity. What do you believe the benefit is to the medical industry of having this type of conference and pulling a lot of people together?
That's a great question, Jill. I think the biggest benefit is an opportunity for us working in this field to get together and to have discussions. At least in the presentations that I'm involved with, I try to facilitate honest, open dialogues, because unfortunately a lot of folks in this very politically correct, hyper sensitive society that we've evolved into, they don't really want to have an honest discussion about what really needs to be done to solve these problems. So at least getting people like this in a forum like this, we can take a step in that direction.
That's terrific. Again, I'm with Dr. Michael Drues. He's the president of Vascular Sciences in Boston. Dr. Drues, if someone wants to find you or Vascular Sciences, is there a website they can go to?
Yes, first of all, they can check out my LinkedIn page. I've got a lot of information on there. You can just go to that, or if you want to go to my company website, that's www.vascularsci.com.
Very good. Well, thank you for being with us today.
Thank you, Jill. Pleasure to be here.
It'll be interesting to see how this innovation plays out. This is HealthTech Talk Live, being broadcast to you worldwide on iHeart Radio. I'm Jill Schiaparelli, your host. I'd like to thank UBM Canon for sponsoring the MedTech Conference here in Philadelphia, and a special thanks to 1-800 Public Relations for their media and PR support. Have a great day.